Alright, and we're off. You want to do the thing? Alright, and clap your time. Beautiful.
Cool.
Mate, how is sunny Queensland treating you?
It's quite delightful today. It's always entertaining. I'm busily still having fun and games with vendors of cryo machines, not quite living up to expectations, but the machine's been fun and games.
Let's do the preamble. So for everyone listening, I'm talking to Scott Wustenberg, the amazing, the wonderful
Thank you.
chiropractor from Queensland. Knows all about nutrition. Well, a lot of things.
Yeah.
And I'm Eric Hansen. I basically just punt questions to Scotty and he answers them for me. So it's all good.
Yeah, cool.
So, mate, the cryo chamber up and running.
It is absolutely up and running.
Exciting.
It's been a lot of fun. I've got people down to minus 196 degrees. And surprisingly, people let me take photographs of them. They actually look quite happy, but I think that's just like their face is frozen in position, and they're just
it's locking up into a smile grimace, which is all you need.
Absolutely, but it makes other people out in Facebook land believe that it's all good and safe, and no, it is really. But there's this wonderful experience of being proper cold like that in a dry cold environment that the first minute you don't really kind of have much attention to it because it's like, oh wow, this is new and cool, it's not really cold, and the second minute you kind of go, ooh, yeah, no, actually I can feel that a bit, and then
she freezing.
Yeah, then the third minute it's counting down, kind of go, oh, when is that going to finish?
Let me out.
Pretty much.
I was having an argument with a guy who is sort of more of a proponent of cold bath exposure as to cold sauna exposure, and he was saying that the effects of the cold bath being in water was more profound than cryo saunas, and then I did a brief search, and everything's kind of poo-pooing that idea, but he was saying that the cold permeates deeper and you can do it for longer. So from the actual cold impacting the body, the cold baths might last for longer. But my understanding of the cryo chamber was because you're getting to such a cold temperature.
Yes.
You're having much more of an impact on genetic expression than you would.
That's really what it comes down to. So I'm not hyper interested in the actual ice pack idea, which is where the cold baths have really come from. It's a very traditional idea because, recently we've found that when you actually ice pack something enough, you can actually damage the nerve anyway. So we're really not wanting to deeply permeate in that same way. We're trying to alter the circulation. We're trying to alter the genetic expression to get those longevity and survival genes activated. So he might be right. It might have a longer cold effect on it, but you can actually damage the tissue a whole lot more at that 0 to 1 degree mark in a wet environment, which, getting tissue wet and making it ice cold isn't necessarily such a great thing. So,
but yeah, the shock being the magic thing as opposed to just a nice cold bath.
That's it. So yeah,
because I'd imagine with both you're getting activation of your parasympathetic nervous system, the vagus nerve starts to wind up, all those wonderful things. Well, to a point, I suppose, then you're going to get into the stress mode. And go, I need to get out.
That's exactly it. And I think really you have to get into that stress mode. And that's really, I think, the inside of that 1, 2, and 3 minute mark. By the third minute, you're properly in a sympathetic pattern. And then you step out and you go from like the chamber cold of 196 or whatever it might be, and you step out into 20, 25 degrees, and you've just traversed 200 degrees in literally a second, and your body shunts the blood supply around, and you get this endorphin rush at that moment in time. It's like, oh, I survived it, yes! And that's where that parasympathetic buzz actually comes in, and you get this glow in your skin, and you feel really quite tingly and alive, and it's a really very pleasant sensation.
I survived. I didn't die. Yay.
And I'm certain that's where a lot of the modulation actually comes from. It's that pleasant rush of my body, oh, I feel good now. Ooh, I'm warm, yeah. And it starts to give you a nice kind of brown fat shiver. And I'm very hopeful that the more I'm doing it, my body will actually be giving me a whole brown fat conversion, and we're getting rid of a lot of that white fat. That's
get rid of that nasty white fat.
Yeah, absolutely. Yeah, so
Beautiful.
all fun and games in the tuning it and getting it to work as per. It's still a little bit expensive in the gas department at this moment in time. We're not getting quite the 2 to 3 litres per session that I was hoping for, but we'll get there.
Mate, trial and error.
Yeah.
I'm sure you. Yeah, it's just because cheeky little leak.
Yeah.
Bit of duct tape, that'll sort it.
Oh, if only. The putty hasn't been quite working to plan, but some engineers are a bit interesting in their application of solutions.
Yeah, well. But mate, I was sort of perusing my Facebook stream of interesting and weird stuff that tends to come across. And one of the ones that I thought was quite interesting, and we talked about briefly in our preamble, was the with Alzheimer's disease. One of the things that they're finding with MRIs is you get these little amyloid plaques that start to get deposit, and those amyloid plaques were traditionally thought to be just sort of metabolic garbage that's causing this little clump of crap in the middle of your brain, and then you get too many clumps of crap, and your brain starts to look like Swiss cheese. But this paper was sort of suggesting or found some evidence to support the idea that those amyloid plaques were actually encapsulating herpes virus that was sitting in the brain. And we know that viruses in the brain aren't a good thing, but your sort of body's natural defense mechanism is to wrap it up in these amyloid plaques. But unfortunately, with viruses that keep on giving, you start to get more and more of these little plaques. Comments, suggestions?
Well, absolutely. As we know, a lot of the herpes infections like shingles and chickenpox get into the body early on in life. So as an 8-year-old kid, you get your chickenpox infection and you get over it, but you don't actually sort of kill the infection. You suppress it to such an extent that you're no longer struggling with it. And what seems to occur is that the virus likes to live in the fatty tissue of things like the spinal cord and the dorsal root ganglia. And it comes back to life when you stress yourself hard enough, and it starts expressing neurological symptoms. And this is why they have started trying to develop a shingles vaccine for maturing people. And what's really interesting is that they're showing that the body's defense of some of these infections seems to be trying to block leakage of this stuff through the blood-brain barrier into the actual brain itself. And so it's encapsulating it by actually trying to glue a hole in the membrane because you're leaking like a sieve. Now that raises some interesting questions about what's driving that leaking like a sieve. Is it the virus itself? Is it stress? Is it alcohol? Because that's a really good one for knocking out the blood-brain barrier's impermeability. And what we're seeing is fundamentally we are getting an organised response that kind of, because it's not... we're not winning, you're not suppressing the infection effectively enough, just keeps growing and growing and growing because you've got to keep getting on top of it.
So in essence, it's the good old case of as we age and stuff starts to break down, we're getting more and more leaky spots in our blood-brain barrier, so that dormant herpes virus starting to migrate into places where it shouldn't. So the key then being, let's make sure that blood-brain barrier stays as healthy. Like, it's not just the virus, it's going to be a combination of your crappy lifestyle, lack of exercise, eating macas 3 times a week, and the rest of it.
Yeah, absolutely. The interesting thing, there's another thing that I published or put out there into Facebook land about fluoride being bioaccumulative, a neurotoxic carcinogen, amongst other things. And you just kind of sit there and you go, well, maybe that's another factor that's actually creating havoc for us. And,
So wait, bioaccumulative being that we don't have any effective way of flushing that crap out of us?
Not once it's in your nervous system. So, no, you probably do have ways of flushing it out. It's just that you don't. And what it does is it replaces your iodine. And so anywhere that you require iodine in the brain, which is to make a lot of your nerve cells work, we can replace it with fluoride, unfortunately, and that tends to cause a whole lot of havoc for you. So it's really shown to actually make a mess of your blood-brain barrier, and that may be something that's actually helping create this effect that, you start off nice and young and you're fit and you've got testosterone and you can repair things. And, the foolish part seems to be we do this have kids thing, which ups your stress levels, decreases your testosterone, as we spoke about before. It diminishes your sleep, which then causes your cortisol to go up. And as your cortisol goes up, your gap junctions and tight junctions start stretching and leaking. And this is, again, another one of those ways that stuff will bioaccumulate in the brain that you don't really want. Viruses, fluoride, it doesn't really matter. The suggestion is that these things are part of the glial defense mechanism, and perhaps we've got to get those lymphatics to actually work a bit better. Now, I had an argument a little while ago with someone who said, well, alcohol's really good for the lymphatics. It actually helps flush the brain, so you should drink alcohol because this paper proves it. I'm like, yeah, the lymphatics will go up if you bioaccumulate toxin in the brain. That doesn't make giving alcohol to the brain a good thing. It just means that your lymphatics are having to work overtime. So just in case, the lymphatics are the brain's lymphatic system. And so that's what helps get the stuff out of your brain and into the body to be cleared out at some future point in time.
Yeah, that seems like let's take alcohol to increase your lymphatics. I'm just trying to think of a decent analogy. I can't. It's just dumb. Yeah, I'll come back. We'll circle back to that one. It's sort of be, well, I suppose it'd be like if let's increase your anyway.
Yeah. Well, stay away from the sugar as well. Like, that's another absolute one. If you screw up your blood sugar signaling, you're absolutely going to get your brain into trouble. And that really does seem to actually drive an inflammatory cascade that does lead to kind of tangles and tau accumulation, etc.
So with lymphatic system being the sort of common denominator for whether it's virus or a leaky blood-brain barrier that's letting fluoride in or whatever the case may be, lymphatics is where it's at as far as getting nasties out of your brain. Doesn't matter what it is. Are there any effective either treatments or supplements that you're aware of for upping lymphatics other than alcohol?
I suspect that it's actually most affected by respiratory function. So cerebrospinal fluid will move in relationship to expansion and contraction of your spinal system, which is set by the diaphragm. So there's craniorhythmatic impulse. So as you breathe in and out, the spine expands in length and contracts in length, and this actually pumps cerebrospinal fluid around the actual spinal column itself. So this pressurizes the ventricles in the head, squeezes them, relaxes them, squeezes them, relaxes them. And that's actually how you pump cerebrospinal fluid out of those aqueducts down around the spinal cord to the sacral bulb and then squeeze it back up again. So the best thing we can do is actually regulate our respiratory rhythm to actually get that long, slow squeeze on, squeeze off, not which is what stress breathing will do, and most people are actually breathing far too quick. What a lot of people out there probably don't realize is that you're meant to breathe 6 to 8 breaths a minute. And so, you're meant to be kind of 10 seconds of breath, 8 seconds of breath, not, and by that I mean the whole breath cycle, breathing in, out, and then pausing at the bottom for a second. Most people really aren't doing this because we're all so discombobulated that, we're running from a monster basically all the time.
Well, that and you're, hunched around a desk or a smartphone, it's a bit hard to get a full lung expansion when you're in that super kyphotic posture, the whole hey, we can swing it back to chiropractic.
Yeah.
Get your thoracic spine loose.
Well,
finally, I was waiting for a moment.
It absolutely works so. I mean, if you get your thoracics and your ribs opened up, it really makes an impact on your ability to breathe. And then you just have to be conscious of setting that rhythm and keeping that rhythm going so that breathing actually becomes a non-conscious 10-second cycle. It takes about 90 to 120 days to set that rhythm, though.
Yeah. Well, I'd imagine then that so with that squeezing and relaxing of the spinal cord, the yoga is going to be a good one.
That's a really sensible idea, absolutely. And a big shout out to anyone who's doing it.
Keep the herpes at bay.
Well, I think it'll help. Things that we know definitely help are things that boost immunity. So things like I utilize a product called Restore to actually help activate and strengthen tight junctions. It's a liquid product. It works well for the gut, but it works on any tight junction
too, which is handy.
Yeah, it can't be something I devised. Anything with zinc in it's going to be upregulating for white cell function, and we really want to get your macrophages and lymphocytes actually working in good order. You could use things like reishi mushroom and lion mane mushroom, or mushroom complexes that different companies are putting out to actually help with these things. Cold laser is shown to be particularly useful for these situations. You could use different frequencies of cold laser to actually stimulate the lymphatics both in the head, transcranially, as well as in the body to actually help get rid of viruses.
So I wanted to circle back to that. So do you just get a violet laser?
I just got a violet laser, absolutely.
Outstanding. Tell me all about it, because that's specifically for sort of bacterial, viral, pathogen flushing work, rather than the red laser being sort of more restore and tissue healing.
Yep. That's exactly it. So it's down in the ultraviolet frequencies. So we're down in the 400s, 405. And I've had a couple of people that I've used it on and actually reported some nigh on instantaneous alterations in temperature and in soreness of people's throats.
Brilliant.
Yeah.
Oh, okay. So during the cold season.
Yeah. So
come in and get your violet laser on.
Well, that was it. And although we weren't really expecting that, we were treating them for issues as a chronic sinus infection. They got up and went, "Oh, my throat's less sore," and they actually had a mild temperature at that moment in time when we remeasured it, and it had gone down.
Jesus, mate, you could build an entire business around that.
Well, you could, but see, we're not going to be claiming anything here. It was an interesting thing. We were therapizing them for other stuff, and we're not claiming that we can cure the common cold. Let's not make any silly mistakes.
Perhaps not.
But one way or the other, the science is solid on the fact that ultraviolet light helps kill off mold and bacteria, etc. And fundamentally, anything that we can do to decrease those and viral load in someone's system has got to be a good thing for them. But the benefit of this laser system is that it also uses it's an EVL, so it's got violet and red coming out of the same laser at the same time.
Okay.
So
I was going to ask you, do you use them in conjunction?
Yeah, I do. Absolutely. So I'll use like a red laser 2000 hertz to try and stimulate the lymphatics while also using the violet laser. So you're trying to decrease the infectious load and stimulate the lymphatic system to actually get the stuff moving so you can actually pee it out, and then hopefully hydrate the people really well so that they actually do pee out dead matter and it doesn't stay in the tissue.
Have you read any papers using violet laser from a transcranial point of view, looking at that viral accumulation in brain or nervous tissue to flush that out?
I have, I have read them, and I've gone through some of the American laser docs webinars looking at transcranial use for both TBI and for infectious load, and certainly their anecdotal evidence is showing that, and one of them's been doing it basically nearly as long as I've been in practice, so I have a feeling he's seen a few cases. The evidence is certainly in the literature that ultraviolet light will kill off viral or decrease viral load and boost, certainly you can impact sinus infections and things like that with it, definitely. I haven't read enough at this moment to feel absolutely confident and going, aha, yes, I've got the magic cure for everything. But, you get the thing and you keep upskilling yourself.
Yep, keep searching,
Yep.
mate. That's next time in Queensland, maybe you can zap me with a purple laser while I'm getting frozen, and then zap me with a red laser as well,
Yep.
and then just start pelting me with supplements from the sidelines.
Well, what we'll also do at that stage is then we'll stick you in the H-bot for an hour to increase your oxygenation.
It's just an hour lying down without interruption sounds.
That is my favourite thing. People go, oh, I don't like being trapped in there. I'm like,
are you kidding?
No one can get me for an hour. Like,
get more responsibility, get more on your plate, mate. If I don't like being in there for an hour. Oh, that's crazy talk.
That one's been actually really interesting. Looking at the literature on H-bot, I was reading data last night about how they're actually finding you can use it repetitively to basically treat acute breakdown, relapse, and multiple sclerosis. It'll actually keep people's multiple sclerosis lesions at bay and start to improve healing. Yeah.
I read a paper about the hyperbaric oxygen work post sort of immediately after an acute stroke. Mm-hmm. And it was reasonably significant for improving sort of your capillary regrowth back into the damaged tissue and minimising the loss of brain tissue area, which was exciting stuff.
That's exactly it.
And I think that's also getting to that because I have had a few post-stroke patients who are sort of several years down the track. But they were recommended to get hyperbaric chamber work done after their stroke by their attending doc.
Wow, that's good.
So, yeah, it seems like the research for that. I mean, it's not just us crazy kooky chiropractors who are reading the research. It's also the people with the actual keys to the city. Starting to do the good work as well.
Well, that's good news. I mean, the nice thing is that it's showing that several years, like anyone out there listening who's had a stroke multiple years ago, they're still showing that you can get some benefit. You might not get as much regeneration, but a lot of these cells, especially kind of on the edge of where the center of damage was, are in an idle mode. And if you give them enough oxygen, they'll actually come back to life again.
It's one of those things that just gives me the shits is when people are told by someone that you've had a stroke. You just have to. This is how life's going to be. You just have to get used to it. That's as good as it's going to get.
Oh, exactly.
And whether that's for stroke or you've got to blow in your disc and saying, oh well, this is just you. You're a bad disc person. You learn to live with it. Limit your exercise. Stop lifting. Stop doing this.
That's it.
And then it's just a accepted norm that and then it's almost that you've got to convince people. No, if you do something about it, things will get better. But it's sort of that instilled belief that because this person said I can't get any better, that I can't get better.
Oh, it's just so annoying. I've got a patient like that at this moment who's come in, he's like in his mid-30s. He has a CT scan showing that his disc is problematic and he's got some sciatica and has an antalgic lean and, all the classic signs, except for he can take his leg past 30 degrees without blinding pain. And when we do cluneal nerve release and fascial release and laser his low back, he can touch his toes and do anything and stand up straight and the pain goes. But of course, it's under work cover, so guess where the doc wants to send him? Straight to a neurosurgeon. Because
it's got to be that sciatica. Yeah.
Absolutely. And he, when he went in, because we'd shifted where the pain was, the doc said, well, how do you know it wasn't the chiropractor causing this?
Oh, stop it.
I loved it. It was really good.
Oh, stop it. Are you good friends with this patient at this stage so that they took one look at that and went, yeah, no, thanks, buddy, I'm out?
Yeah.
Went, you know what? Maybe it was that chiropractor.
No, they were supportive, and their dad was there as well, who's been a really long-term patient and knows that we've made improvement. But they're using the language of catastrophization, and this is one of the things that I think we really need to get out of all of our practices, chiropractic, medicine, everywhere. We've got to get out of catastrophe. Oh, you've got a blown disc. Oh, well, sorry about that. You're stuffed for life.
Yeah, well, it just comes back to that, blown disc. You'll just have to forever come in and see a chiropractor once a week for the rest of your life.
Yeah.
Because
Well, there's a business model.
Your back will explode upon itself the moment you sneeze.
Exactly.
Anyway. But circling back to what I really wanted to talk about, being blood-brain barrier issues and viral load issues.
Yep.
I read another paper that was sort of pointing out the link between autoimmunity and psychiatric disorders.
Oh, yeah.
This paper was talking about three specifically, being like anti-NMDA encephalitis, Hashimoto's encephalopathy, and we've already talked about the herpes effect that can have. And then further on, we're looking at with the autistic spectrum, the PANDAS, style stuff. But there's papers to suggest that even depression could be considered, or some types of depression. There's an autoimmune component to depression as well.
I think that's very apt. And the question mark is one way or the other. All depression is inflammatory in some way, shape, or form, and is it autoimmune or is it not? But the classic diagnosis for celiac disease in this country is actually a 45-year-old white female. Sorry to sound gender and race specific, but that's the truth. That's what the statistics show.
How dare you?
How dare I? Exactly. Who comes in to see her physician with either intractable depression, so it doesn't respond to anything, or to weight that won't go. Okay, so it doesn't matter what she does, I change my diet, I lower, and generally this is the classic change in diet. I go off my high fats, I stay eating some bread because bread's good for you, it's full of grain, you've got to get your fiber in. And at some point,
makes sense.
the GP decides to trial, gluten-free, and they basically go off it, and 6 weeks later they're like a different person altogether. And so what this is showing up is that behind a lot of these things there are, again, HLA-DQ genes that are reactive, and this sets the person up when they get stressed enough to start an autoimmune reaction, and then of course it keeps getting triggered by the continued addition of the food aggravant that actually keeps the whole thing alive. And as soon as you take it away, the immune system basically calms itself down. Now, when you look at that from the herpes point of view, because the herpes never really goes away, it's always there hiding in the background. You have to actually suppress it to such a point that it can't trigger the autoimmune response and keep making an inflammatory cycle keep going. So it's a bit harder than gluten. Gluten's easy. You just take the thing away and the people start to feel better. And infection, on the other hand, is a real bad one. And the autoimmune response to PANDAS is a great one. It's very dear to my heart. So PANDAS is pediatric autoimmune neuropsychiatric disorder acquired by strep. So you get a strep infection, usually as a kid, and the body makes an immune response to it, but it for whatever reason, gets a dysregulated immune response. And the antibodies start attacking things like the brain. Now, again, we could look at the facts that they're getting leaking in the gut, they're getting leaking in the blood-brain barrier, they're under stress, there's a bunch of different reasons why. Now, what goes on from there is that the people will get infections in the future, or they'll be exposed to a low dose of strep, and that low dose of strep is not like a full-blown, oh, look, I'm dying here, I'm getting a really bad disease, but it's enough to trigger that immune response. They make more antibodies, and the antibodies go out and attack the nervous system. And this is where that psychiatric component starts coming in. They can have hallucinations. They can get Tourette syndrome. They can get chorea, and their body parts start to twitch and jerk and do all sorts of funny things. The worst case scenario that I've heard of is it can generate locked-in syndrome or a similar synonyms chorea around it, where they just can no longer control their musculature in a way that's meaningful. So, we've really, as all health professions, chiropractic, I think, really needs to upregulate its skill levels with regards to infections and neuroinfections, because, we're neurological focused practitioners, yet we're really not on top of this infection affecting the brain and nervous system area.
Too true.
So, herpes simplex 1 seems to be a really good one for that one. Molecular Labs put out information and a study on that one where they were showing the herpes virus can trigger an anti-NMDA receptor encephalitis, as you were mentioning. And so, fundamentally, how many kids get simple herpes simplex? Cold sores.
Oh, Jesus.
Awesome. And then think on that. So that means that adults all have this, and then what we're waiting to do is get ourselves stressed enough and non-resilient enough and alcoholed enough and poor slept enough, because, again, these things are there. It's whether you open the door to it.
Your system down enough for it to start lighting fires again.
Basically, and then again, if you trigger an autoimmune reaction, meaning that you make an antibody to the thing, and then that antibody really closely mimics, so it's called molecular mimicry. That's where the problem actually kicks in. So you have an antibody that is targeting a structure that resembles your own tissue. And if that tissue happens to be the NMDA receptor, or, a neuron or an axon, or it doesn't matter. This is where Hashimoto's thyroiditis kicks in, because, again, that particular autoimmune condition which affects the thyroid has similar molecular mimicry in other parts of the body, because the body's kind of seems really complex, but it uses a whole lot of the same stuff in multiple different places and multiple different ways. You've only got a very finite amount of amino acids, vitamins and minerals, oxygen, hydrogen, etc. that make you up. And, the magic of you is how you got put together by that gene pattern that mum and dad gave you. But realistically, again, we've probably got less than 200 basic parts, and they all get recycled to do everything that's in your body.
Yeah, that molecular mimicry is huge pain in the ass.
Yeah, absolutely. So what disease is that one?
Pain in the ass. Thank you, ladies and gentlemen. We're on that.
Yeah, thank you. But yeah, you're absolutely right. And of course, what we fail to look at is things like Epstein-Barr is herpes simplex 6. Most of the infections that we're getting early on in life are herpes simplex or herpes type viruses. So, cervical cancer, known to be herpes viruses. There's 40 different variants of that. We're now kind of trying the vaccinations for about, I think 4 is what the 4 major ones. Now, what got really interesting in the literature on that one is that they basically were targeting the top major 3 or 4 viruses that created the cancer, and were supposedly suppressing them very effectively. And this was allowing the other ones that weren't really responsible to become a lot more damaging. And there was this really interesting thing that I was listening to, which was actually about how thought came about and the transfer of information. And they were talking about this using the analogy of viruses. and that how we function and what goes on in us might not actually be possible without some of these viruses in our system, and that they're actually responsible for allowing some of our genetic architecture to function. And it was the first time I'd actually thought of it that way, and maybe our drive to actually knock all the infections out by creating a vaccination is actually allowing some problems to occur, because those big viruses that we're now vaccinating for actually suppressed some other ones.
Yeah, that's interesting.
Isn't it?
So,
I don't know.
You need the viruses to strengthen up your immune system, and then you take the viruses out, and your immune system no longer strengthens up as much as it perhaps should have back in the 1400s.
Yeah, it's a really interesting thought. I hadn't considered it that way. It was the first time I'd actually kind of gone, oh, virus, good for you. Because, we're trained to basically go, all viruses are bad.
Yeah, that's I hadn't thought of it that way.
It's kind of, if you look at it, it's an extension of probiotic theory. E. coli, for instance. E. coli is a bacteria that can cause a whole bunch of problems, right? We hear about these E. coli outbreaks and everyone gets vomiting and diarrhea. But you have E. coli humanins that's naturally occurring in your own gut. Without it, you can't make charismatic acid, which helps produce vitamin B3 and vitamin K and a whole bunch of energy in your system. Coenzyme Q10's made from this thing. So, we've spent the last...
Kind of need that E. coli family.
Well, yeah, you really do. You just might not want external strains that aren't designed to be in you. And this is a really interesting point about probiotics. Of course, as it turns out, we kind of go, oh, look, there's a pill of probiotics. Maybe they're really good for us. But the question that you got to raise is, where did we get that bacteria from? Because, it's lactobacilli. Great. Yes, but the numbers, so you'll see the lactobacilli and it's got a number next to it, right? The numbers represent what source it came from. And there's lactobacilli for horses and cats and rats and dogs and humans. Yes,
Gotcha.
for all.
Yep.
So when you pop that pill, did you double check that it was the human version? No.
Cat stuff's cheap.
Yeah. See,
with probiotics, I feel like it's. Every 6 months the research out on it is doubling or tripling. If I wanted to keep in touch of all of the research coming out with probiotic work and the gut microbiome mapping project, it's an exponentially growing field, and the stuff that we're doing now, I'm pretty sure in 5 years' time they're going to be, no, that's that gave you cancer.
Yeah, absolutely. Well, my favourite thing though is currently we've had this wonderful young lady by the name of Ashley who's been in our clinic using the space to actually do fecal microbiota transfer, which for some people is absolutely life-saving. It alters their entire biome. Well, basically they get rid of the biome and replace it with one that's actually kind of viable, and it decreases all the inflammation and autoimmune conditions in most cases. But
interesting. So getting rid of the microbiome with a enema and a whole bunch of antibiotics.
Yeah, absolutely. So you ablate the person's.
So you go scorched earth, and then you swallow a couple of pills with a little bit of poop in them.
Well, I'm not sure that's exactly how it's done. So it's a direct transplant. Yeah, absolutely, and it works really effectively. But the Sydney Morning Herald has very recently this year put out a paper, an article, Creating Crapsules. Is Feces in a Pill the Cure for Other Ills? And there's actually companies in the US actually making capsules for oral consumption, as you were alluding to. Now, the problem that I have with that is that the right way to get it into you? Because it has to bypass your stomach acid. And, anything that you wrap effectively enough that bypasses your stomach acid is basically kind of a type of plastic. And that may not be the best thing to put in your gut anyway.
Yeah. Perhaps not. Yeah.
Yeah.
Yeah, that's going to stay there for a while.
But no matter what we're showing is that if we can get these healthy microbiomes into people, regardless of whether you do it orally by a capsule or by FMT, what we end up with is a situation where people's inflammatory autoimmune conditions start to be suppressed. And this is where that feed-forward mechanism actually can come in, whereby the input from the bacterium tonifying the vagus nerve in the gut actually has an effect on the brain and the brain's control over the immune system. And so one way or the other, it's a really viable way forward for us that it may actually help us control a lot of these infections and affect the brain, and maybe will have an effect on tau protein and beta tangles and all the other fun things that are going on inside people's heads.
Yeah, that's exciting.
Isn't it?
That's very exciting.
Yeah.
Yeah, they're writing themselves. The poo potential. Hey?
Love it. It's certainly something I'm very interested in, because, again, I got to this particular point in my life and all the stuff that I talk about because I got pleurisy about 10 or 12, 13, 14 years ago, somewhere there, and ended up in hospital, and the treatment that they gave me for it ended me up with bleeding of the bowel. And yeah. And it took me about 6 months to get that under control. That was no fun, I can tell you. And so, instead of having like a cast iron gut and being able to eat almost anything, what seemed to occur is those latent HLA-DQ genes that kind of confer celiac risks, etc., seem to want to activate at that moment in time and have never been quite the same since.
Bugger.
Yeah. So it was only after I got on to giving up gluten and dairy products that my tummy started to get itself into a healthier, happier environment. But, if I get cross-contaminated or if I get hyper-stressed, I still continue to have a less functioning bowel than I'd really like.
Mate, well, okay, you do the guinea pig work.
Yeah, thanks for that.
Yeah. Let me know how it goes, and if it sorts you out, then we'll add that to the list of things that will get done as soon as I rock up to get my bloody immune system under control with a few powerful poo.
Yeah.
It's a third pill. Powerful poo pill. There you go. Trademark it.
Love it. Yeah, so ultimately, I think there's definitely a place for this stuff. I love the title, though, Crapsholes. I mean, that's just an absolute goer. I'm still, as much as I know it's safe and clean, etc., I'm still not quite so certain that I really want to swallow one.
Yeah,
exactly. But I'm kind of... Let's face it, if it's going to give me a viability that'll help me live a longer, healthier life and stop, because let's face it, we've all been exposed pretty much to either cytomegalovirus or chickenpox virus or, if you could pick it, we've had it as kids.
Yeah, everyone said something.
Yeah, and these are the ones that are coming back to punch us in the brain. And, if you can upregulate your immune system by actually getting a biome that works for you and actually suppresses that inflammation. Because, again, no matter what, we look at these studies and we talk about, herpes simplex triggering the encephalitis. Really what we're talking about is a systemic failure, and it's showing up in a localized region. So, you're aware of your symptom in your brain as your brain is, falling apart because that's where it's triggering at that moment in time. But what's the difference between that and that virus triggering liver cancer in someone? Or, it doesn't really matter. This stuff is systemic. And what we have to be doing
process is the same, just where it happens to light the fire.
Exactly. And so I want people kind of thinking about these things going, right, what I'm meant to be doing is actually improving my global health and well-being. So lots of my patient work is really about altering their lifestyle behavior and their dietary choices and how they think and how they move and actually getting their quality of life up. Not going, oh, look, I'm going to treat your left wrist because that's where all, it doesn't work that way. It's getting you to interface as a global being, that your brain and your, like the biggest complaint that I've been harping on about recently is what Descartes and the church did to us kind of 300 odd years ago, and it never really came back to rights. And Descartes, being a philosopher who really didn't want to get lynched by the church for kind of offending them, left us with this idea of the brain and the body being separate, or the mind and the body being separate, and the mind and the soul were the preserve of the church. Okay, and while we know that the dualism has been debunked, what's gone on is that we have a treat the body concept and a treat the mind concept. And the mind is, psychology, psychiatry, meditation and all these things that are good for the mind. Or, you go see your counselor or your priest and you deal with your soul and your mind and your spirituality, when in essence these two are they're not mutually exclusive. Yeah. Your body is generating your mind. So if there's a problem in your body that's inflammatory, it's going to affect how your mind. If you don't have the building blocks to run your body properly and you're starting to get threatened, how do you think your brain's going to work? If you
start eating that as well.
Yeah, it basically fails. What occurs is you basically start running what I call decompensation. So you've got a certain amount of resources to cope with everything in life at that moment in time. If you don't have the building blocks to run everything, you will shut stuff down and you will go on to kind of a more autopilot. So, I don't really need that little toe and I don't need that piece of skin over there, so it becomes numb and I can't run that organ there particularly well. But we're going to try and keep the blood and the oxygen supply to the brain, the heart, the lungs, intrinsically stable so that we keep those things going and hope that at some point everything comes back. Now, again, if you've got a virus in there, if you've got a bacterial load in there, and you've been drinking, and you're just at some point going to shut stuff down, which becomes irreparable, and this is what we call disease.
Yeah.
Now,
all good and well until you shut down something that was really, really important.
Absolutely. And then what occurs is that, the average person with a neuropsychiatric disorder is treated as if they're crackers, and we give them, antidepressants and anticonvulsants and off-label this, and we sedate them and we give them Valium and we do all these things. But we're not commonly going, you're having a reaction straight after that strep infection your brother got. I've got a real personal lived experience. My daughter's had pandas. So my eldest daughter has had antibodies to strep. And when she's had an exposure to the infection, her ability to think and form thought, etc., goes away. Now, what's really cool is we've got her so well worked at this moment that she can actually feel when that load starts to get back up again, when she's been exposed, because her thoughts start to fog and she can't think clearly anymore, and she becomes more anxious and she becomes more reclusive and she stops wanting to interact with her family members.
Yeah, Jesus, that's a hard thing to go through, but when there's a fixable mechanism.
Oh, yeah.
That's behind it all, that people could be doing something about it, because you've just described brain fog, becoming a bit reclusive and not really want to engaging with the rest of the family, as 80% of teenagers out there.
Absolutely, but how many of them are going to have had a strep infection in their life? How many of them eat junk food up the wazoo? Because of course, guess what the dietary change specific for trying to treat strep is? These are lactic acid producing bacteria, okay? So what food helps make lactic acid? Glucose. So you have to put them on a low glucose, glucose-free diet. No fun.
Yeah, gotcha.
Everyone hates it.
Yeah, tell that teenager not to have any sugar.
Yeah,
so that goes.
absolutely.
But I suppose if they do it, then they're getting their brain back.
Well, that's true. But what's cool is they get the fog coming back really, really quickly when they break the diet.
Mate, that's yeah.
Yeah.
Awesome. Yeah, huge issue. But mate, we should probably talk about that and a bit more specifically at another date.
Cool.
I think I've got patients who are just about to start rattling and rocking.
Absolutely.
Remarks. People, get your blood-brain barrier in control.
Yeah.
Let's see Scotty for some violent letters.
That'd be fun.
Anything else, mate? Closing remarks.
Closing remarks, stay away from sugar as much as you can. Don't drink alcohol as much as you possibly can. Love yourself. Start with self-validation. Everything starts from I love me.
Hey, that's beautiful to finish on.
I
love it.
Thank you. Have a beautiful day.
And for everyone listening, if you want to get in touch with Scotty, Google Optimal Life. It'll come up. And his contact number there is 0733710222. If you want to get in touch with me, I'm at brainandbodyhealth.com.au. It's 0298176611.
Awesome.
All right, guys. Thanks for listening. See you next week.
Have a great day.
Thank you for watching. To learn more from Dr. Scott, visit our site at optihuman.com.au.